Recording in progress.
Hello, everyone. A very warm welcome to another lecture of a COVID Diaries. Today, we have two speakers with us. Our first speaker, for everyone, I would request everyone to kindly put off their videos and put themselves on mute. And we have a limited capacity on Zoom. So, after that, if you're able to enter, then you can join via Facebook and YouTube. We have a live on Facebook as well. And if you have any questions or queries, please feel free to ask them and put them in the chat box. Our teachers will address them as time permits. We have two speakers. Our first speaker will be talking about energy chakras affected in COVID times, and our second speaker will be talking about the pathophysiology and COVID management. Our first speaker for today is Dr. Meenal Sohani, and she has been practicing homeopathy since 1994, over 27 years of practice. She's a counselor and a regression therapist and has done a detailed study of body's 7 energy chakras and how they affect us, not just in mental or physical health, but how they affect us in our daily life situations. She will be sharing her understanding of how chakras can help us understand COVID as an event and how disturbances in these chakras can cause specific problems within us during COVID times. A very warm welcome, ma'am. We are very, very glad to have you and have this understanding of the energy chakras now.
Thank you, Dr. Ali. So, I'm sharing my screen now. Hello, everyone. I'll just share my screen and we can start then. So, hello and a warm welcome to everyone. And I know this is a little offbeat topic because not everybody knows about energy chakras of the body. So I will start with a very small and quick introduction of what chakras are and how they affect. And then we will move on to why chakras or knowing about chakras is so important. I will also quickly touch upon how I understand these chakras and how do I make use of them in my day-to-day homeopathic practice, also as a counselor and as a hypnotherapist or a regression therapist. So let's quickly move on. So let's start with what are chakras. Chakras are basically situated along the spine, and as Eastern cultures know about the energy flow through the body, different cultures have known these energy patterns in different ways. In homeopathy, we call it vital force. In Ayurveda, we call it prana. In Chinese medicine, they call it chi or kui. So these Eastern therapies and homeopathy, of course, and yoga, we all recognize that body has a innate energetic flow that is very, very important for our health and well-being. And this innate energy flow flows through 72,000 nadis, as we call it in Ayurveda. And Ayurveda calls it prana, which flows through 72,000 nadis in our body. And the concept of chakras is very, very common, and it originates through our Vedas and Upanishads, the ancient scriptures. And the scriptures say that along the central nadi or the central channel, which you see here in the diagram as the red channel, there are vortices, there are whirlpools of energies, and these whirlpools are named as chakras. Now, at these points where the chakras are located, it's like a high voltage point. There is a great energy flow, and it's very, very interesting that with the help of a pendulum like this, you can easily diagnose the flow through these chakras. So as you can see, now the pendulum is rotating in the clockwise direction. So in the northern hemisphere of Earth, the pendulum rotates in a clockwise direction if the chakras are flowing very smoothly. So we can diagnose chakras with the help of pendulum. But since I have been studying these chakras, I have developed a method of diagnosing chakras even through life situations, behavioral situations, mental health or emotional patterns. So interestingly, exactly at the spots of these high voltage points or chakras, we have endocrine glands in our body. As you can see, the thyroid is exactly situated at the level of throat chakra, or we have thymus at heart chakra, or pancreas and liver at solar chakra, and so on. And we have absolutely at the same point, we have nerve plexuses situated. So what happens is whenever these chakras or the flow through the chakras gets disturbed, the glands and the nerve plexuses directly lying along the chakras also get affected, and the entire functioning of the body, our nervous system, our behavior, our attitudes, everything changes. Now, how do these chakras then affect us? Obviously, they affect our health and our behavior and attitudes. But interestingly, these chakras function like a huge magnet, and they attract towards them the certain kind of situations on which they have an effect. For example, Muladhara or root chakra has an effect on the material possessions or our finances, job, and everything. So if our Muladhara chakra is disturbed, we will have situations in our life which affect our material possessions. So many times, by knowing which chakras in your body are disturbed, you can almost predict what kind of health problems you will have, what kind of mindset you will have, and what kind of life problems that you have. So clearly, these chakras will also then affect our attitudes as a spiritual being. So our spiritual journey through our lifetime is also affected by these chakras. Now, understanding the functioning of these chakras will help our client to heal in a better way, and not just with homeopathy, but a lot of auxiliary methods and a lot of other healing therapies also can be suggested to our clients. Now, today I would like to discuss with you how understanding of these chakras will help us not just in diseases, but also in COVID in particular. So I believe that these chakras are like miasms. Just like how we understand diseases and classify them in miasms, these chakras often set the tone of how the person is responding to his life situations. What is his general attitude towards life and towards diseases? So now, if I understand that a person is extremely scared about the financial stability in his or her life, I will help the person in correction of these attitudes. So not just the attitude, but energetically, I would help this person in correcting his root chakra, because root chakra affects the attitude in finances. And I can suggest a lot of supportive measures, like I can give affirmations, I can ask the client to use specific colors or gems or do specific yogasanas. And there are certain 5 elements of the nature attached to chakras, and we can do therapy through these 5 elements also. So interestingly, these chakras will tell us how the prognosis of his health would be, like if the certain chakra is affected, how the diseases will progress, how his life situations will also progress. And as homeopathic physicians, we will know what kind of remedies we can select for this person. So if this person is someone who's has a disturbed heart chakra, then we know he's likely to have emotional disturbances. He's likely to have lack of self-love, and then we can choose the remedies accordingly. So now a quick touch up upon the 3 important chakras that I'm going to talk today in relation with COVID. The first chakra that I feel has globally got affected is root chakra. Root chakra is situated at the tip of our tailbone, which is coccyx, and we practically sit every day on our root chakra. So what does this root chakra, how does this root chakra affect us? The first thing about root chakra is that it affects the basic survival of any human being, meaning how safe physically we are, what is the material security in our life, how easy or how difficult is my life depends on my root chakra. So root chakra will affect the client's material possessions. The usual house, car, finances, job, what kind of abundance he has in his life, are resources available to him, is his life very rocky and full of obstacles? All that will depend on how well the root chakra is functioning. Now, in terms of body, root chakra also affects the general well-being of the body and how good your immunity is. General immunity I'm talking about. So root chakra will also decide how a person feels stable and secure through the life, and what kind of trust level he has that his life is going to go well. So a sorted person with root chakra will feel absolutely trustful about his life, and he will feel that my life is going to go well. I'm going to have solutions and resources readily available whenever I have problems. So this is a general healthy attitude through root chakra. Now let's understand how globally root chakra got affected. I always call COVID as global root chakra crisis. Now, I just told you the issues under root chakra. You will see that the first thing that we got worried about is the threat of infection. So all those people with poor immunity, with a little, decreased level of health, they got affected by COVID very, very fast. And there was low survival rate with people with lower immunity. Almost all of us, every one of us had their finances affected. Either financial planning crashed, businesses crashed, there was economic crisis through the world. People went into debts. Due to health, there were a lot of expenses. So everybody felt this financial pinch throughout this COVID time. Now, interestingly, there were some people who were adversely affected in finances, but some who were into selling masks or medical equipments, they exploited the situation. Now, being victimized in finances and being the perpetrator, being someone who exploits, both these issues come under disturbed root chakra. So people had both these manifestations sort of in disturbed root chakra, that some people were victims of other people's exploitation and some people were actively exploiting other people. Now, all of us experienced unpredictability of life. We really felt that we don't know how our life is going to be. Am I going to get infected? If I'm infected, am I going to need hospitalization? Will the medicines be available at the right time? So many of our doubts and fears were coming true. We lost trust and assurance in the well-being and generally in our life. So what you saw around you in the lockdown period was extreme anxiety and fear about finances, about health issues, about getting infected, and then landing into a situation where there are no hospital beds available. Especially in India, there was a situation when hospital beds were not available. People were not getting the right kind of medicines or oxygen supplies. So a shortage of resources was faced in India by a lot of people. So typically, if you see material possessions, finances, health and immunity, and shortage of resources, all these are issues of root chakra. And throughout the world, we experience these issues in different intensity and different facets. So I would call COVID as a global root chakra crisis. Now, typically, a person with disturbed root chakra would be worried about what are the presentations. I will just quickly tell you. People with disturbed root chakras often were very, very anxious about their immunity, whether they are going to get infected. These people were absolutely obsessed with cleaning themselves, washing hands, using sterilizers, mask, 2, 3, 4 masks, and wearing hand gloves all the time, not going out. They completely locked themselves in throughout the lockdown period. So they were extremely anxious about their health issues, and they were anxious that they will land up in a situation where there are lack of resources. Now, either these people had financial anxiety or then they landed up in actual financial problems. So they were worried that they will lose their jobs, or they will have financial problems, they will have to pay for the hospitals, or they were worried about the exploitation. Now, whenever I saw my clients having these kind of extreme anxiety and worry about root chakras, being a counselor, I understood that if they have this anxiety, meaning eventually their root chakra is also going to go into chronic disturbances. So generally, when I see this, I know that once the root chakra starts getting disturbed, this person can actually attract a situation of getting affected or infected in COVID, and they will actually face lack of resources then. So generally with these kind of clients, I started suggesting them healing therapies of root chakra. Now, root chakra is directly connected to the element earth. So getting in touch with earth in the form of gardening, farming, getting in touch with your body, because body is another manifestation of root chakra. So exercising, having body massages, going for a walk, all these were started with these clients, and these therapies help getting the root chakra again stabilized. Now, there are other therapies. As if you know a little bit more about chakras, you would know that in our 5 senses, every sense is connected to one chakra from lower to upwards in a serial order. So root chakra is connected with breath. So I taught many people how to do pranayam or how to do abdominal breathing, and that also helps healing the root chakra. There are certain sound frequencies which we call as bija mantras. So these sound frequencies also help creating a calmness in the root chakra. And for root chakra, it is the sound frequency of lam. So chanting lam, the way we chant om, in a similar manner also would help stabilizing the root chakra. The root chakra matches with the color frequency red. So if you use the red color more often, like red colored curtains, red colored clothes, or having a flower vase on your table with a red color, that also helps healing the root chakra. I gave many people affirmations like, I acknowledge my anxiety of COVID and I choose to let it go. So affirmations were tailor-made and affirmations were given, and it is seen wonderfully. Like if there is a client with a disturbed chakra, if you hold the pendulum on the chakra and ask the client to say the affirmations, the pendulum starts moving in a clockwise direction, which means that affirmations open up the chakras instantly. So affirmations were used to help the clients. And of course, we know through homeopathy, there are many, many remedies which cover this financial anxiety or health anxiety, like arsenic, kali carb, calcarea carb, many carbon remedies, camphor. These remedies were used for these kind of patients to stabilize their root chakra. Now, very similar to all these therapy where chanting, colors, affirmations, homeopathy elements were used, also, as a consultant in Homeopathy Yoga Center, we used yogasanas to help these patients. And these are certain yogasanas which also help stabilize our root chakra. Padmasan, Janu Shirshasan, squat pose, Kegel exercises, knee chest pose. These are the poses which help open out the root chakra, and they were also prescribed to these clients. Now, this is a typical scenario if your root chakra is disturbed. The next chakra that I'm going to talk about is heart chakra. Naturally, heart chakra is situated in the center of the chest, and it affects lungs and heart. And we all know how in COVID, lungs were the primary area that got affected with many, many, many clients. Now, if you know about heart chakra, out of many themes, the one important theme in heart chakra is related to self-love, self-acceptance, and healing. So the thymus gland, which is situated right in the center of the chest, is very, very functional till 8 years of our age. And we all know thymus gland produces immune cells, which helps us fight the diseases. Now, interestingly, when you love yourself really, you protect yourself fiercely. So the issues of self-protection, self-preservation, having a good immunity is also connected to heart chakra issues. Also, the heart chakra element is air, which is so important for a good, lung functioning. And so many people affected in heart chakra had their oxygen levels dropping and had a lot of problems with the respiratory complaints. Also, very importantly, heart chakra is connected to the sense of touch. Now, the first thing that happened in COVID is that we were distanced. There was social distancing and we couldn't keep in touch with each other. So the sense of belonging, mixing and mingling with each other, meeting friends, meeting family, having a kind of a sense of being a part of the larger society went completely missing in the lockdown. So people with heart chakra disturbances got even further affected. Then losing the loved ones created a lot of guilt in some people. Did I do enough for this person in my family? Was I, negligent or reluctant to put him in the hospital? So many of the doubts and questions came to mind when people lost their loved ones. They were filled with grief, hurt, and they further got their heart chakra disturbed. So many times what I saw was that if there were arguments in the family, because in India especially, we have joint families, we have many family members staying together, and being locked down in a house for a long periods of time gave rise to a lot of arguments, fights, resentments amongst the family members. And if this acted as a causative element for the COVID, then many times what I saw was in these people, the will to fight back or the real desire to fight for their life went missing. Their lack of self-love or their reduced self-love, their guilt, their hurt, their grief affected their heart chakras and directly affected their immunity, directly affected the way the body cells were fighting back. So interestingly, these people had predominantly lung presentations. Predominantly, their CT scores were higher. They needed oxygen supplementation. They were the ones which needed ventilators eventually. And their will to fight for themselves was not enough. And interestingly, all my patients who got pulmonary presentations or complications in COVID, when I traced them back, they had some or the other heart chakra issues in the form of either guilt or grief or lack of self-love, either as a chronic situation in the background or some acute issue that caused the actual COVID infection. So obviously, I suggested heart chakra therapies like, heart chakra element is air. So whenever possible, sit in the open air, go into plants or grass, since green and nature is also an heart chakra element. We use the mantra yum for them, and chanting of the mantra yum, use of green color, specific affirmations like I love and accept myself, I choose to fight for my well-being. And of course, we know in homeopathy medicines like carcinosin and natramur have a lot of self-rejection and lack of self-love. So carcinosin, natramur, ignitia, many of the lacs like lac maternum, lac defloratum, these were the remedies which really helped these people sorting out their heart chakras very well. Now, the third chakra that got affected before the third chakra, obviously we gave them some yoga poses like cow face pose, camel pose, bow pose. If you will see the pictures of all these poses, you will see that they open out the heart chakra. They actually enlarge the chest compartment of the body, and it helps opening out the heart chakra. So yoga also was used. Also, we can use some crystals, we can use some specific foods, some hasta mudras, but I thought that at least you will get some flavor of how we use therapies. Now, the third chakra that got affected due to COVID in many patients, and sometimes it was this chakra that was make and break point, because solar chakra is like the sun in our body. It is right at the center, the pit of our stomach. And this is a chakra which is a very important chakra where you feel the sense of power and control over your body. This is the chakra that gives us strength and positivity to fight with our life, to fight for our life and to fight with diseases. So the endurance, the resilience, but the motivation to fight back and win comes from this chakra. Now, to fight a disease like COVID, you obviously need a lot of willpower and determination. And what we observed is that during the course of COVID or during the course of this whole lockdown, when people started feeling helpless, which is now the other polarity of solar chakra, which means it is a experience of disturbed solar chakra, when people started feeling helpless, discouraged, they resigned to the infection, they started feeling that I cannot fight back my infection. That's the time the real downfall of the patient started. So many times the initial signs were that these patients had blood sugar disturbances, their blood sugar went haywire, they had loss of appetite, digestive disturbances. Many people had vitamin D dropping drastically down and needed large doses of vitamin D. All these are signs of disturbed solar chakra. And these people with disturbed solar chakra started feeling extremely helpless and started feeling that medical fraternity is not understanding how to help me. They started fearing that the treatment will fail. Nobody is coming to help me. I am trapped here in the hospital. I cannot fight back. And the moment they started feeling hopeless, helpless, and depressed, COVID kind of started winning. And the moment the help to recover was gone, they felt very, very powerless to fight these infections. So what I retrospectively saw is that people who were then progressing very fast and their health was deteriorating, they needed ICU setups, were those ones who resigned to the infection, who gave up the fight, and their solar chakras were affected. Now, the characteristic of solar chakra is the positivity, the sun, the fire. So you have to ignite the fire and the will to live again. And that's why directly sometimes when we understood that this person might go into a solar chakra disturbance, we asked them to take vitamin D supplementations, used to, ask them to sit in the morning sun, started asking them to use the sound frequency or Bij mantra Ram, use the color yellow, and affirmations like I have a strong willpower and I choose to feel positive, I choose to fight back. So along with all these methods, obviously in homeopathy we have remedies like Naxwamika, Lycopodium, Sulfur, Soranum. These remedies typically affect the will. We all know how Naxwamika ardently fights the situation. So these remedies were used to heal the disturbances in the solar chakra. Now, interestingly, these yoga poses, goat pose, the seated spinal twist, warrior pose, these poses were also suggested to these people. Interestingly, what happened was, in some patients, what I saw was a combination where all three chakras got affected. Meaning, initially we saw that they were extremely worried about whether the COVID is going to be a threat to their life. They were not having the ability to protect themselves or fight back for oneself. And then suddenly they started lacking the will or the courage to defend themselves. Now, when all these three disturbances happened in the patients, the death rate was very, very, very high in such cases. So what I realized was, if your root chakra, heart chakra, and solar chakra progressively or all three of them get affected, then the prognosis in such cases was really, really not good. So interestingly, I used chakras as a diagnostic and prognostic tool. Chakras indicated the behavioral pattern. As I told you, if I came to know that this person had a fight in the family and then got affected by COVID, then I knew that heart chakra was a problem. I told these people that you have to increase self-love, you have to fight back. So understanding which chakra got affected and then the person got COVID also helped me understand that where this patient can go, what can go wrong, and why certain organs were affected, like why blood sugars were affected in certain cases, why certain cases had pulmonary presentations, why some people didn't get the medicine or the oxygen supply when they needed it the most. I understood. Also, I could understand and choose the remedies wisely according to the disturbances in the background. And I could use the auxiliary measures like changing the attitude of the person. And I always used to tell what is a healthy attitude in a specific chakras, use of colors, use of yogasanas, use of certain specific mantras, use of affirmations. All of these things helped me to support my homeopathic treatment. So I hope this discussion about chakras has helped you understand a bit about a different aspect of healing, the energy chakras and how they affect us, and how for a healer or for a homeopath, they can help us in our healing modalities. So I hope that this discussion has helped you a little bit understand the chakras and how in COVID scenarios we get affected by these chakras. And thank you so much for being a part of this discussion. And if there are any questions, I would like to answer these questions. These are my contact details. If any of you would want to give me a feedback, write to me. I would really appreciate your feedback. So I'm opening my chat so that I can read out your questions and answer them. So I have one question. Does sitting long hours in front of the computer will imbalance root chakra? How to keep the balance? No, the root chakra is not affected by sitting in front of the computer for a long time. Generally, we don't know why chakras get disturbed, but definitely due to some negative thoughts, the chakras can get disturbed. Due to negative life situations, chakras can get disturbed, and vice versa. Because the chakras are disturbed, you can get negative thoughts or negative life situations. What are the remedies that you gave in homeopathy for solar plexus? Typically, all our remedies like Naxvomica, Lycopodium, Carboveg, all the remedies that affect the digestive system, all the remedies like Robinia or acetic acid, which especially act on hyperacidity, are all good remedies for solar plexus. Remedies which have depression, resignation, a feeling of unfortunate feeling like Calcarea self, which feels unfortunate, troubled, China self, and lot of sulfur salts are very, very good remedies for solar plexus. Somebody has asked, how do you use colors? So there are the 7 chakras are exactly a frequency match for the 7 colors of the rainbows. So when we understand which chakra is affected, for example, if root chakra is affected, we ask the person to use red color often in his or her life. Like as I told you, you can have a red colored curtain where you'll see that curtain every day, or a red colored flower vase on your dining table or study table. You can wear red colored clothes if you like. So this way you can use these colors a little bit more often, so that the color frequencies also kind of heal you. Many people also wear those crystals of red color in their either their ring or as a bracelet, as their jewelry, so that these colors will keep healing you. Okay, daily practices to enhance chakra power. Now, for chakras, we can do meditation on these chakras. We can do affirmations. We can do chanting on these chakras. I have my own YouTube channel as Dr.Meenal Sohani, and lot of these daily practices of chakras are all they are available on my channel. You can just go visit. Dr.Meenal Sohani is my channel. Do batch flower remedies affect chakras and energy? I am sure they do, because batch flower remedies affect our health, our emotionality. So anything that affects our health and emotionality, I'm sure they affect chakras and energy. I have not particularly studied batch flower remedies, so I won't be able to tell you which remedy affects which chakras. But generally, if you see, the location of chakras will itself tell you that all the organs in the vicinity of the chakras will get affected by that chakra. And from knowing which batch flower affects the will, for example, or the rescue remedy which helps the person in panic, will obviously help the person with root chakra disturbances. Something like this you can understand. Preventive and curative measures are the same. Yes, for chakras, the preventive measures are the curative measures. Also, chakras are connected to the 5 elements in nature, like root chakra is connected to earth. So for root chakra disturbances, we tell people to, develop hobbies like gardening or farming, walking on the grass barefoot, things like that. Or for solar chakra, sitting in the sun, morning sun is very, very helpful. And thank you, Bindu. She said that I was always curious in learning chakras, and wonderful session. Thank you so much. So we use these 5 elements in nature to also help enhance our chakra power. How to use pendulum for cleansing? We don't use pendulum for cleansing. We use pendulum only for diagnosing. Like I told you, if you hold the pendulum like this, now this pendulum is exactly at my throat chakra. So now this pendulum is rotating according to my throat chakra power. So this will tell me if my throat chakra is open, is it functioning normal? Many times what we do is, when we diagnose chakras for people, we hold the pendulum on their body. If the pendulum is going anti-clockwise, or if it is standing steady, that means that particular chakra is disturbed. Then I give the client a lot of affirmations, and with 1 or 2 affirmations, the pendulum suddenly starts rotating clockwise. So you know exactly which affirmation will heal the chakra balance for that particular client. And this way we use the pendulum to help the clients. How to select a remedy when there are disturbances in 2-3 chakras? I normally ask my clients which pathology they have come to me with. If they tell me that I am here especially to cure my digestive disturbances, that is one way of selecting the remedy. That if the person is more interested in digestive disturbances, then we deal with solar chakra. The second way of selecting remedy is, I normally see how is the attitude of the client towards the disease. Meaning, if the person says to me that, oh, I have come to you for my thyroid. But if the person says that I'm doing so much in my life, I'm, following all the dietary restrictions, I'm doing everything, why do I get a problem like thyroid? Am I the unfortunate one? Why do all the problems exist in my life? Now, this why me attitude is a typical solar chakra attitude. So if I see that the person has thyroid problem, but the attitude is of solar chakra, then I give first the remedies for solar chakra, and then I might give some specific remedies for thyroid. This is the way I deal with disturbances in 2-3 chakras simultaneously. Can you make the Preurum, I don't know, I think pendulum. Okay. Can you make the pendulum at home? Yes, pendulum, any chain with any heavy locket or something at the bottom of it, if you hold, it acts like a pendulum. So you don't need to have a crystal pendulum like this. Even if you hold a locket on your body, it will start rotating like this. So anything with a string and some heavy object in the bottom can act as a pendulum. The only thing about pendulum is that you need to have a blank mind to diagnose somebody else's chakras. Since the pendulum is in my hand, my thoughts will affect the pendulum. So when I am using the pendulum to diagnose someone else, I need to really be neutral in my thoughts so that I get the correct diagnosis. Remedy for disconnection with reality and fear. Now, disconnection with reality is a little tricky subject. Why? Because when you're disconnected from the reality, many times there is one more chakra at the bottom of our feet. Like when you place both your feet together, there is an energetic chakra in between, and that chakra is called as integration chakra. When you have disconnected, when you have a disconnect from the reality, many times the integration chakra gets disturbed, which means that your mind and body are not integrated together. And if there are mind and body not integrated together, then you can't do chakra reading for that person. So according to chakras, if the person is disconnected, first you need to ground the person in the body. Remedies for disconnection of reality are mainly remedies from Magnolini family, Magnolia grandiflora, then if you see the Yakir's chart of plant remedies, from the first column in Yakir's chart, the top remedies like Nux moschata, like Magnolia grandiflora, like Lotus, all these remedies are mainly the remedies for disconnection with reality and lot of fears and anxieties. So these remedies will help you there. What about post-COVID effect in digestive system, decreased appetite relation to chakras? Many people still have continued solar chakra disturbances even after COVID is over. So generally, if post-COVID, there are certain digestive systems remaining, you need to deal with their solar chakra. Chakra and remedy selection for anxiety and depression. Generally, anxiety is a characteristic of root chakra. So then you will have to select the remedies which affect the root chakra, because anxiety generally is about health, about well-being, about so many things. Now there are various types of anxiety. If the anxiety is social anxiety, then it comes under sacral chakra. So it is very difficult to generalize this remedy selection for anxiety, what kind of anxiety we need to see. And generally depression, hopelessness, discouragement comes under solar chakra. So again, remedies like Nux vomica, Bryonia, China, Carboveg, which affect mainly the solar plexus, will be good remedies for anxiety and depression. Okay, so I guess I have answered most of the questions. Dr. Harleen, are there any other questions that you have? How should we chant Yam, Ram, Lam to keep all the chakras healthy? So the chanting is generally done very slowly, the way we chant Om. And the vibration, generally I ask my clients to feel the vibration in the body. I also tell them to visualize the chakra at that place. So for solar chakra, or maybe I will show you for throat chakra, because then you can see me directly. So throat chakra is situated right here. So you can visualize a sky blue colored chakra at the place of throat chakra. And for throat chakra, the Bij mantra is hum. So we say hum and try to feel the vibration here. So generally chanting is advised for 21 times or 108 times. But even if you just keep chanting throughout the day whenever you can, the chakra chanting is more of a phenomena of frequency healing rather than a spiritual or a religious practice. So the more often you match the frequency of a certain sound, your chakra will keep healing. For diabetes, which is the chakra affected, diabetes is right. The pancreas is situated right below solar chakra. So for diabetes, solar chakra you need to work on. What chakra is ears? Ears, ENT practices are throat chakra. And kidney trouble, since kidney is dealing with fluids, it is nephritis and kidneys come under sacral chakra. So any kind of fluids, because sacral chakra affects the water content of the body. The element in sacral chakra is ocean, sea or water. So anything that is connected to water or the liquidy elements is directly related to sacral chakra in the body. So Harleen, I believe, thank you so much, Archana. And Harleen, I believe that we are at the end of our sessions. Thank you, everyone. Thank you so much for taking a part in this discussion. And thank you so much, Harleen, for your support.
Thank you so much, ma'am. I think it was a very integration of the understanding of chakras, colors, and homeopathy beautifully, and miasms also put together. I think it becomes easier for homeopaths to understand through those lenses. And it's been beautiful. Thank you so much, ma'am.
Thank you.
And moving on to the next lecture, next speaker, we have Dr. Manisha Kamble with us. She has her practice in autoimmune and infectious disease clinic. She is a consultant at Prana Homeopathy Yoga Center based in Pune. And she has won the award of C.V. Raman in 2014 Ranjo and Badre Group, Pune. A very warm welcome, ma'am. I think after understanding chakras and miasms, we would really like to understand the pathophysiology in COVID cases. And for everyone, I would request to kindly put their videos off and mics on mute. Thank you so much.
Yeah. So thank you, Harleen, and welcome all to the world of homeopathy again. So let me share my screen. Yes. So coming back to the homeopathy, just refresh your mind once again. Yes. So today I'm going to discuss with all of you the pathophysiology in the COVID. So why it is important for an homeopath to understand the pathophysiology. This is I came to know through certain experiences, and I realized that yes, the pathophysiology is very important in the management of COVID, especially we treat a patient, as a homeopath at home. So it is very, very important, right? We all are aware that what is COVID. It's a severe acute respiratory syndrome. Coronavirus 2 is caused by SARS-CoV-2 virus. It's mainly an airborne infection through the droplet. So, and we know the structure of virus and all is being, we are dealing this COVID crisis since more than 2 years now. So we all are aware about it. So why the pathogenesis is so important in the management of the COVID? Uh, let's see that. So, just coming back to pathogenesis, we know that the coronavirus, it has an outer layer that is called as the S protein. Now, this virus use this, outer layer to get attached to the S2 receptor in the body. The S2 receptor is this virus uses this as an access to enter the human body. So what is this S2 receptor? It is an angiotensin converting enzyme 2 receptor, right? So the idea is that the more is the S2 receptor in the body, the more will be the virulence, the more will be the viral load. So if you know that the COVID disease, it has a two phase. It is a biphasic disorder. One is the viral replication phase that lasts from first to 9 days, and the second is the inflammatory phase that lasts from 9 to 14 days. So we know that the whole quarantine period is of 14 days, but we know that after 9 days, patients, they don't transfer the infection. They transfer less likely. They are prone to transfer the infection to the other person. It's only because the viral replication stops on the 9th day of the illness. Now, what is these two phases? The first is the viral replication, which is regulated or controlled by the T helper cells in the body. This response is commonly seen in the female as well as in the children because of their thymus gland, right? So we are seeing that this female and the children, they are developing a mild to moderate form of infection because of this response is more active in the female and the children. Now, in the second phase, that is the inflammatory phase, which is called as innate immune response, which is nothing but the hyperimmune response of the body that causes the cytokine to get released, right? This is more commonly seen in the male, and we are seeing that the mortality rate is very high in a male compared to the female. So what happens in the cytokine when the cytokine gets released, what happens exactly is that there is the certain types of cytokine markers get released in the body. They are causing the damage to the cell, and they form there is a formation of hyaline membrane and the release of the TNF, the tumor necrosing factor, and the interleukin 6. We have heard of this interleukin 6 quite a lot, in the investigation. So what is this interleukin 6? Inter means in between. Leukin means between the leukocyte. So these are the messenger which transform the information from one cell to the other cell, right? So what this interleukin 6 does, what this interleukin does in the body, it precipitates the hepatocyte to produce the CRP. So another investigation we are commonly heard that CRP, and CRP. How much is the CRP? So this is how the CRP is of utmost important in the management of the COVID, which I will show you through the certain few cases later on. Also, this interleukin 6, this precipitate the beta cells to proliferate in the body to produce the antibodies. So the interleukin 6 is of lot of important. It is the first cytokine marker to get released in the body, and that produces the CRP. So whenever there is high level of CRP, there will be a high level of interleukin 6. So So the interleukin 6 is indirectly in proportion to the level of CRP. So usually what happened in the COVID, rather than doing many tests, I came to the conclusion after understanding this is that whenever there is high level of CRP, there will be a high fibrinogen, there will be a high D dimer, there will be a high ferritin, and there will be a high level of interleukin 6. So rather than doing all this investigation, what helped me to monitor the patient while actually treating for that total 14 days is the CRP. So why the CRP is of so important, let me tell you that. First, the CRP rises 4 hours after the inflammation sets in the body. It rises rapidly and it gets crash also very rapidly, right? The CRP rises by double every 8 hours. So the rule is in the modern science is that to maintain this CRP below 5 on the 5th day of infection and below 10 on the 10th day of infection. If your patient's CRP is less than 10 on the 10th day of infection, these patients are less likely to develop the cytokine storm. If it is normal within 10 days, that means your patient is stable and he is out of COVID crisis, right? Because the viral replication stops on the 9th day. So another thing is that if there is persistent high level of CRP, if you notice after 10 days, that itself indicates a thromboembolism. That means that thromboinflammation, that means there is clot formation in the body, and the patient can develop the cytokine storm or the severe form of COVID crisis. So this CRP is of very, very important while managing the patient on homeopathy. I will show you through certain cases. Also, normally the CRP is below 1, but in COVID, the significant value is considered as 10. If it is more than 10, it is significant of COVID. Not necessarily always, but this is how the protocol has been made. If the CRP is between 10 to 26, it is called mild infection. Between 26 to 100, it is called moderate infection. And above 100, it is called severe infection. So what I do in my practice, I do a CRP, say whenever the patient comes to me. If he has the CRP investigation done, it's good. Otherwise, say if the patient is coming to me on the first day, I do the CRP test on the first day. Third day, I recheck the CRP because as I said, the CRP increases rapidly and it gets crash also very rapidly within 17 hours. Crashing of the CRP indicates that the recovery of the patient, right? If it is stable and not at crash, then also it's okay. That means your patient is stable and he will be recovered soon. After the third day, if my patient is absolutely all right, I don't repeat the CRP. I directly repeat the CRP on the 10th day of infection. Why? Because again, the viral replication stops on the 9th day. And if the CRP is normal on the 10th day, that means our patient is stable and recovered from the COVID crisis, right? So let's do a case one. Now this is maybe for a few of the attendee, my cases may be a repetition, but these are my learning cases, and I wanted to tell you again and again. These have been observed and managed very carefully. So let's see this first case. This is an elderly female. Her age is 65. She is having diabetes. She is having dilated cardiomyopathy. So much of high risk patient, isn't it? But what happened? She has been exposed to the son-in-law who tested positive 3 days ago, and the whole family approached me. By the time I gave them a homeoprophylaxis and asked them to do a test, her test came positive on the third day, and that is the time she developed the first symptoms. And what was that first symptoms? She had a nose discharge, watery while eating. So very peculiar. How many patients will tell that I have a runny nose while eating? Very few patients, right? So bitter taste in mouth, and she was just feeling feverish. She has not yet developed the fever also. Okay, done. Only these three symptoms, and there were no any other complaints from her side. Mine was also okay. She was looking little anxious, but not much expressed by her, right? So when I asked her to do her CRP, but what happened before that? I repertorize her symptoms: discharge, eating aggravation, nose discharge, and bitter taste in mouth, feverish feeling you cannot repertorize. So I got the two remedies, the causticum and the plum balm. So and then I knew the family, and I know that the lady is sympathetic. And even in the past, once upon a time, I have given her a pulsatilla. So here I felt that she is a sympathetic by nature, and the repertory showing something like causticum. I should go ahead with the causticum. So the causticum was given, and the evening she was absolutely fine. No bitter taste, and the appetite was normal, and there were very mild runny nose while eating. So then on the sixth day, her X-ray is absolutely normal. This indicates that such a high risk patient not develop the progression of disease. It's only because of the homeopathy, right? So what helped me here is her CRP. CRP on the onset of the symptoms was 6.49. In between, I have not tested because she was absolutely fine. And on the 10th day, her CRP repeated, which is again back to 1.2, right? So CRP on the day 10th, 1.2, that means my patient is out of COVID crisis, because 9 day the viral replication has stopped and she is out of any danger, right? This is how, every case I have studied the CRP and managed with the help of CRP. This is my first case of the COVID in the second pandemic, which taught me a lot, because of the so much of high risk patient can develop complication anytime, but only because of this surety, I was confident enough to manage such a high risk patient. Now, second case, if you see, this is a case of a patient, male patient, 79-year-old. He called me on the 7th day of the infection. Now, remember these days also, why I'm highlighting, you will come to know soon. So he is a chronic smoker, and he was very weak. He was unable to talk because of the weakness. When I spoke with him, his oxygen level was 81, and there were no appetite. He was having lot of mouth ulcer, he said. That's why he's not able to eat. Diarrhea after eating. The thirst was less, and he was having desire for warm water. He is having cough also, which was on talking more. And there was an exertional dyspnea, which we have seen very commonly in many COVID patients, right? And but surprisingly, this patient was at home only, and the family was, requesting him to go to hospital, but he was saying, no, I don't want to go to hospital. Now, what happened with the set of these symptoms? For my first prescription was arsenic album 1M, the desire for warm water, the thirst less, diarrhea after eating, and the weakness. So I gave him the arsenic album. After 2 doses of 1M, there were no recovery. Rather, he dropped his oxygen level to 74. And that is again, I got a call that he's not recovering and his oxygen is now 74, doctor. And he's not yet ready to go to hospital. And absolutely, there were no bed available also in Pune that time. And they were also hunting the bed also for him. So, and with that, I said, what else symptoms you are observing right now? The relative said his body is cold to touch, So the sudden drop of oxygen level, the body is cold to touch and do not want to go to hospitals. What I am missing now? So what I did, I just, first thing I repertorized for the arsenic also. That time I took one rubric, which is that weakness influenza during. And surprisingly, it was not covered by the arsenic, right? And the Campora has that rubric. But desire do not want to go to hospital. I was not able to correlate that time. So I trying to do whether he needs a company, so company desire for, whether he has the fear of being alone, so the company desire, alone aggravation being. So these rubrics were taught, and again the Campora was coming. So interestingly, whatever I studied from Sankaran sir, from his Iran experiences, and the way he found the prophylactic camphora, it belongs to the Magnolidae family, right? It's a fourth subclass. Again, it's more with the security, insecurity, and again the strange aggravation, unfamiliar aggravation, desire to be in their own world. They shut off from the outside world, and there is a withdrawal. So isn't it something like that? Because patient was not in a state to describe why he do not want to go to hospital, right? So when I understood that, and when I understood when I came to know about this Campora peculiarities, I was sure to give Campora, right? And again, the sir has already pointed out with this delusion of the Campora that, the things in which the things are clear in his own little word, but the outside is uncertain, mind, delusion, imagination, danger of, The world is moving in a new, so there is always a fear of something uncertainty outside, which we have typically seen in the COVID. The root chakra got affected, what Dr. Meenal also has suggested. So this is how the Campora was given. You will see that he was having the moderate pneumonia. It's a almost pneumonia has developed more than more than the two-third of the lung, right? So, and in the follow here, in the follow-up X-ray, you will see on the 14th day, there is a fainting of the pneumonia. It's not there. On this side, it's almost not there, right? So definitely, there is decrease in the pneumonia has been mentioned by the radiologist. Now, what happened? The pneumonia is there. It's only decrease, right? How do I, have a confidence that my patient is now not develop again that, pneumonic patches and he's all right. And now to be, we need to manage only on homeopathy and we don't need to take any steroids or any allopathic help. How, what will give me confidence? Again, here what helped me is the CRP. Now when he called me on the 7th day of illness, the CRP, I asked to do it, but they did it on the 10th day, the 3 days late. So it was 23. This is actually after Camphora. That means the CRP might be high, we don't know. But again, after 5 days, on the 14th, 15th day, when I asked to repeat the CRP, you will see the CRP is normal here, right? So this is how the confirmation from the CRP. If my patient CRP is normal on the 10th day, that means my patient is out of COVID crisis. Here the patient called me on 7th day, doesn't matter, but my patient's CRP has become normal on the 14th day. He is out of COVID crisis and there will be a regression of pneumonia. Slowly with the medicine you treat or don't treat it, that pneumonia will not flare. This is how the confirmation I got it and seen in many cases, whatever I have done on my own, in the practice. So this is how the his oxygen level after the Camphora 97, 98, 74, it means from the allopathy they need an ICU, right? So another case, again, remember the day. He called me on the 4th day. This is a 47-year male with no comorbidities, right? But he was taken the allopathy treatment for first 3 days. He was having itching in the throat, irritation causes cough, dry cough, feverish feeling, no taste, no thirst is normal, but better with warm water. And now the nose is stuffy, which earlier, before taking allopathy, it was running, right? But why he called us? He called us because his cough was aggravated badly, right? And he wanted to take help of now homeopathy. So I gave him based on these symptoms, I gave him arsenic. It's very clear, right? But I asked him to do an X-ray on the same day. The X-ray showed the peripheral ground glass opacity. The pneumonia has developed already. Imagine the X-ray pickups the pneumonia on the 6th day, but this man has developed so early pneumonia and he is lucky enough that the X-ray has picked up. But forget about this pneumonia. If our prescription is correct, a similimum is correct and the patient has responded to it, we don't need to bother about this. Only what is important in management of COVID is maintaining the oxygen saturation, right? So I started arsenic to him and he felt much better within 2 days. But third, fourth day, he was very anxious. Doctor, what about my pneumonia? What should I do? Any test? I have not asked CRP in this case. The reason is that most of the time when they take the allopathy, the symptoms also get masked and the monitoring, the investigations also get masked. In a most of the patient I have seen that. So rather than wasting time on the CRP, I felt to get the X-ray done. But he said, no, I will go for the scan. And because of this arsenic state, he had done the scan and you see that on the 4th, 5th day, his scan is absolutely normal. The CT scan normal. The pneumonia has resolved so fast, right? So this is how each and every case taught me. Now, reason for telling these 3 cases is that first case on first day, second case is on with a few symptoms, second case is on the 7th, and third is on the 4th day. So my observation in the COVID is that when the patient calls us, calls us, till that 9 days of the illness, till the viral replication is on, they mostly, all patients mostly need an acute remedy. Okay. And if there are very few symptoms or those who are asymptomatic carrier, they call us. I always investigate them because they need more deep acting remedy. Okay, so there are two types of things that are happening on the homeopathic management, either purely acute remedy if the symptoms are very predominant and matching to the best acute similimum, or if there are few symptoms you need to work on a little bit more, even on their mind aspect, right? So this is how I understood through the few cases. Now see the another case, we'll skip this case. Again, it is an acute case. Now this case is also very interesting. This case taught me, this is my first case which taught me something different, right? So this is a lady, 52-year-old, and she had a fever for 2 days. She took the paracetamol for 2 days. She was having a very high grade fever with lot of headache, body ache, fever with chills, and lot of sweating, bitter taste in mouth, lot of weakness, and she was desire for juices, and thirst, but again small quantity, little for the warm water. So this patient, I have given her China Rs, right? First day when she called me, third day the CRP was 57, which is very very high, 57 level of CRP. After China Rs, immediately next day I did a CRP, and which is 19. It crashed so rapidly. It indicated me that my patient is now doing well. Patient will do well, right? But what happened? She was stable for whole 9 days. Okay, and on 9th day she called me saying that, doctor, I'm feeling weakness, and my pain, there is pain in my abdomen, and the pain is more on the lying down. She has a hernia problem. She is my regular patient, and for the gout, in the past I treated for the gout and the seronegative arthritis with the help of pulsatilla, right? And she was having that time also hernia pain, that also responded very well to the pulsatilla. So now this time she again developed the pain in abdomen at the hernia side, and due to pain she became very nervous and she was moving in the home. This is how the daughter told me. And then I asked, does she has a fever? Then daughter said yes, she's looking warm. Every evening she's looking warm since 2 days, and her thermometer is showing 100 temperature, right? Again I asked to repeat the CRP, and the CRP was jumped up to 33, right? So there is a rise. So why this has happened? Even this is the first case for me while managing many other cases, right? So then I worked on it. I said, get the scan done. When I did the scan, the HRCT score was very minimal. It was just the 4. Maybe this was the earlier, and she was not having cough, no breathlessness, nothing apart from the clue that she is having a fever. So why this has happened? When I repertorize her new symptoms, the totality, I got the set of the remedies: arsenic, belladonna, arnica, pulsatilla, rust. So her constitutional remedy was there, the pulsatilla, right? So I opted for the pulsatilla for her, and with the pulsatilla, she felt much better. So in between the CRP was not done. On the 14th day, I repeated the CRP, and it was 5.63, from 33 to 5.63. So on the 14th day, the CRP is 5.63. That indicates that my patient is out of COVID crisis. As a curiosity, I checked her antibodies, and on the 14th day, the report came on the 15th day, the 30th, and here you will see the 29th day. So the very good antibodies. Now, usually on the allopathic treatment, we see that the antibodies develop, they say that, the antibodies develop from the 17th day to 28th day. That is the period they give, right? But in homeopathy, I have seen that the viral replication all stops also very faster, and the antibodies also develop very fast, right? So another case, this observation, or the same observation what we see now, I have seen in the ICU cases also. Now look at this 52 years old man, no comorbidities. He had a high grade fever, and he took allopathy for 3 days. On the 4th day, he got worse. He started having loose motion, diarrhea after eating, the thirst frequent for warm water. He was also weak. He was anxious. Please help, give homeopathy, he said. I will take only homeopathy, but give me homeopathy, right? Because he had taken allopathy and he felt that I might not interfere in this case. And he said that with these symptoms, I gave him arsenicum album 1 m. Evening, this person called me saying that I am feeling as if I am not sick or ill. I ate chicken and eggs. There is no diarrhea, no fever. I'm absolutely fine. And I asked him to repeat how repetition should be done. Arsenic album 1 and 4 hardly suggested to him. He has not followed me after that, because some of his one of his friend who is an allopath working in an ICU, he's an ICU doctor. He said homeopathy is slow acting. You can take it later on. Right now you take the proper course of allopathy. He opted for it, and I got a call on the 11th day from the ICU that he is having severe breathlessness on lying down. There is lot of suffocation. He desired for open air. He wanted to go out, and this is how I got the symptoms, right? And apart from it, I just know about this patient was that he is a very social guy, and he is a loquacious. Whenever he used to come with accompany with his wife in my clinic, he used to talk a lot. Only these two things I was aware about him. So how to work on this case now? We have to help, because doctor planned to put him on a ventilator. He was already on an NIV mask. So I repertorized the symptoms and I got the laches. Because I knew the two aspect also, the loquacity and the social aspect of this laches. I am confident, even confidently gave him laches. He got better, and within a few days he sent back to home on the 6 liter of water. As soon as he went home, he sent me this video. It's a song. It's a song. You can. So how many patients will sing a song? How many patients will sing a song with a nasal O2 on a 6 liter of O2? This is again a peculiar amusement desire for, which is again in favor of laches. So it was a very good case of laches, and this is how he given his feedback. So this is how the feedback of that patient, it's very, very important, to understand patient. What I understood from these two cases, in homeopathy, few patients are needing two remedies. As the disease is biphasic, once a viral replication stop, they may come up with a new set of symptoms if there is a progression of disease. So we need to be very alert, and take the proper symptoms and the totality, even though the patient is not called you on the 9th or 10th day and saying that I'm again have some symptoms. Don't worry. Most of the time what happen, we think about now to take the help of some modern medicines, or something else, but then whether need an admission. But if we work properly, and if we are clear about the pathogenesis of COVID, then absolutely there is nothing to worry, right? Because if you give a second remedy, your patient is going to get well, and the second remedy they need it, more than 90%, I will say the 99%, after 9th or 10th day they need a deeper acting constitutional remedy. Okay, so again understand this case, the 9th day of illness. Okay, this is again a 56-year-old lady. She was having thyroid, hypertension. Now remember the day, 9th day. Okay, why she called for, she treated only with allopathy earlier, but she called for a homeopathy is only for two reasons. Her cough was persistent, which is on a deep inspiration. The cough used to come in a bouts, and there were loss of taste and smell is still persistent. So she went into a fear, a phobia, and she felt that to take the help of homeopathy. So then I asked her to describe her complaint, and she said that my children should not suffer or catch the infection. Still my son is COVID positive, but I'm taking tension very easily. I am mentally disturbed. If something happens to other, I get affected. Now I'm 56-year-old, and she said I'm planning for a marriage and I need a security. Now in India, 56-year-old lady getting thinking of a marriage is really a peculiar for an Indian culture, right? So this is really a very, very interesting. She started talking and I just was listening to her, what's going on, And then she said, talked about her nature, but I will just read the important things. She said, I like to read a lot, romantic books. I like to read romantic stories. She loves drawing, painting, dancing, cooking, and yoga. She likes to do a painting of a lady, a very, very sexy and the beautiful lady. She liked to draw the naked picture of the female. And she said, I can be naked in front of my love. I love a person, but only one person. I can do anything out of love. My husband used to drink, still I used to love him. We never had a good relationship, but still I love him. When he died, I haven't synced with him. So, what is this thinking? I asked her further. She said, I should have a feeling that I should die with him, which didn't happen as I became practical for my children. But I'm very loving. If I love someone, I can't live without that person or without him. She also has a desire for fish and salt, perspiration not much. She is a constipated lady, and she said that the cough comes on talking and the cups comes on the deep inspiration. Right. So this is what about her important things I have mentioned here. Also, she said that I need a partner for my security. I have enrolled my name for marriage again, and need and financial security. So there were a lot of talk about the support and security in this case, right? But when I repertorize, I first give important in an acute case to the physical complaints. They are very obvious and they are very clear cut. So curve talking during, curve inspiration on, food and drink, fish desire, salty food desire, and there was, and she told about the story of a husband, and they were a very bad relationship, and this is how I took the love, disappointment, unhappy elements from. There is a lot of grief with her. So we know that I got the remedy again, phosphorus, nitrogen, tubercular, carcinosin, etc. But among all this, the romantic aspect, the romantic books and, loving one bond, one attachment, it is very well covered by the nitrogen. I gave a nitrogen to her and she recovered fantastically. Now, the sharing this case is again, she called me on the 9th day, right? Yeah. She called me on the 9th day and she needed a constitutional remedy, right? So after doing several cases in homeopathy, my conclusion is that when the patient call you on the first day, mostly they need an acute remedy. But if there are very few symptoms and if the patient is asymptomatic and call you for homeopathy, they might need an constitutional remedy. Okay. From 3rd to 9 days, the symptoms are, prominent, so they mostly need an acute remedy. From 9 days to 14 days, in the second phase, inflammatory phase, they mostly need an constitutional remedy and few may still need an acute remedy if the progression of the disease is same. Okay, from 10 to 14 days, sure, they need an constitutional remedy. From the 14 day onwards, I have seen in my practice, I got a call not treated on homeopathy because our patient, they get well and they forget the COVID. But I am getting a lot of calls when the patient is recovered on allopathy and they need a state remedy. I have seen the 3 remedies are helping a lot in my practice. One is Camphora, second is Nitrum salicylate, and third is Califos. Camphora, the lot of weakness after influenza. There is a sinus tachycardia. The pulse is 120, 130, patient says, and the palpitation, experience of palpitation, and still the fear of that infection. Camphora is helping a lot. Each and every case, they don't call in the next month. They're just giving a 1 or 2 doses of Camphora and their pulse is back to normal. 1 dose of Camphora and the pulse comes back to the normal. So Camphora is very, very of a great help in my practice. Nitrum salicylate, lot of weakness, experience in the young people, and Califos, lot of weakness after influenza, mainly in a very old patient, very old patient. So these are the, and of course, if not the fit into this, we need to investigate, and few patients are needing the constitutional remedy as well. Okay, so this is how I understood, and I'm still understanding and doing more and more cases. And really, I felt to share with you all because I feel that you can also, it will help you also. You also experience and you can share your experiences with me as well. So the few remedies which I commonly use are arsenic, pulsatilla, camphora, tuberculinum, aspidosperma, phosphorus, even cortisol in the ICU. So these are, ignatia, nitramure, heparsat. These are very commonly, even the calcarea group, calcarea carb and phos. I have seen the many patient phosphorus. I have seen the many patient affected by the COVID. I have also seen the seasonal pattern. Now, nitramute cases I have mostly seen in the summer season. Doctor, we went out, got exposed to the sun and developed the fever. And they turn out to be COVID positive, but they are cured with the nitramute. So even, now this rainy weather is there. So you might need an Rustox and Pulsatilla. So you may need to think like that also. Now, this observation I'm carrying right now, and maybe in the next talk can be tell surely the pattern of that also. Again, the few mother tincture help me is Grindelia, Justica, and Aspidosperma. Okay, Aspidosperma I use a lot in an all ICU cases. Even the lacacious patient was given the Aspidosperma as an support, mother tincture for to maintain the oxygen level. This has helped me a lot immensely, mostly in the ICU cases. Grindelia and Justica, yes, both I have used in many patients. Whenever there is tough mucus and difficult to detach, is Grindelia helped a lot. They desire sunshine, they desire company. And opposite to that, Justicia, they want to be alone. They don't want to be sit quiet, desire to sit quiet. And there is profuse coryza with loss of smell and taste, and there is a rattling of the cough. This works as an anti-expectorant in a COVID patient. And this is what about the my experience today. And now let's see any questions are there. I would like to answer that. I'm going back to my chat box. Dr. Harleen, any questions?
I would request everyone, if you have any questions or queries, please put them in the chat box.
Mm-hmm.
And we have a query about sharing the chart for the lacacious case.
Lacacious case. What is that query?
Ma'am, if you can show them the repertory chart.
Yes, I will. Lacacious case. This is not 1 minute. Let me go back. Yes. Yeah. So, 1 minute. Huh. So what is that query?
Ma'am, the participant wanted to see the sheet.
See, I have just taken the 3 rubrics which were told, and which was obvious, that difficulty, respiration, difficulty, lying amelioration. They said that if he lies down, he feels better. And there is lot of, desire for open air. And if the window is open, he used to feel better. So desire for open air and desire for the, open air amelioration. So only 3 rubrics taken, and the lacacious came. In my thought, the remedy was carbo-wage, right? Because of the suffocation and desire for the open air or the fanning. We know air desire, air hunger. But once with difficulty of respiration, lying amelioration, the lacacious stood the first. And that was the entry point for this case. Any more question? I'm not able to see my chat box here.
Ma'am, there will be a small chat icon on the left to the share screen.
Yeah, I don't know why I'm not able to view it. 1 minute. On the left.
On the Zoom screen, ma'am.
Yeah, I'm just searching on that. Let's go again.
There is share screen, which is a green icon, and then on the left. Ma'am, can you locate share screen on the below?
Share screen, yes, I can.
Yeah. It's okay, ma'am. I'll read it out if
yes.
Ma'am, there's a question about the management of LVH after COVID and how long will the treatment be needed?
Okay. So the LVH is again the complications of the COVID, right? It depends on what stage the patient comes to us, but definitely LVH is not that which will develop earlier. This is the post-COVID complication. So 99% patient is going to need a constitutional remedy. Yes, we can correct the LVH. We can correct the LVH, but with the help of constitutional remedy. You may give some mother tincture or something like that for the left ventricular failure, like Cardus Mure or something like that. But the constitutional will help the patient.
Ma'am, there's a query about if you can show the participants the second last slide, the remedy charts that you have.
The causticum case.
No, the second last slide. The
Second
in
last.
the end, yeah, there
End
were.
case. Okay, yeah.
Yes.
Yes.
Ma'am, the tinctures and the remedies
Oh,
list, which was there in the end.
yeah, tincture and the remedies. They want to show that. Okay.
Yeah.
I don't know why I have to go back again. Tincture, no. Yes. Is it readable or shall I do it on full screen? Because if I go,
Yes, ma'am. Full screen will be helpful.
because I'm going for a full screen, then it is starting from the beginning.
Ma'am, we can do slideshow
Yeah.
here
Yeah.
to the right. Yeah.
Yeah. It's just showing me the slideshow from the
Ma'am,
first slide.
start from. Okay.
Yeah, the
There's a
option
slideshow option here also, besides animation.
besides animation, right?
Yeah.
So start from the current, right?
Hmm.
Yes. Basically, I have used Grindelia for the tough mucus, difficult to detach, lot of bronchospasm, right? Patient has to must sit up, in the bed. Justicia is for the coryza with loss of smell and taste, cough with sneezing, lot of, rattling, something like we know the rattling of antimatter, something like that. And there is no expectoration. So this works as an anti-expectoration, anti-expectorant. So Justica, we have used as an, to bring out the sputum outside, and aspidosperma for all ICU cases, as an support. Any more question, Dr. Harleen?
Ma'am, there's a question about if the GGT is high post-COVID, what does it
Mhm.
mean? And how can the constitution help?
What is high?
GGT.
GGT, glucose tolerance test, right?
Yes, ma'am.
So if the GGT is high, mostly I have seen that a few cases I have done. I don't know, coincidentally, in my cases, they needed an camphora. After giving a few doses of camphora, their sugar is also came back to normal along with the other medicine. But I would prefer to, take the case in detail, because post-COVID management, it's very clear that you need to take a case, as a chronic case. It's a chronic case. COVID is nothing but an autoimmune disorder, right? You need to deal once the viral replication stop on the 9th day, all cases should be handled with the constitutional remedy. Any more question?
Ma'am, what about in cases of LVH, about the repetition and potency?
Yeah, it depends. It depends on the the severity. Right? For my knowledge, I have not seen the many treated many patient of LVH. After COVID, but I have treated in my practice many patients of LVH. As an the only LVH cases related to heart problem. So mainly, the constitutional remedy along with few mother tincture, few may or may not be, but the constitutional remedy, yes, depends on the, again, I use the posology as per, what I have learned from Dr. Rajan Sankaran or Dr. Sunil Anand. We usually give an constitutional remedy in a high dose C potency followed by an LM for a longer period of time. So this, cut down the recovery rate, and it's a beautiful, amazing results we get in homeopathy, particularly in LVH cases. We need to treat it longer and persistently. The LM is of great use in the LVH, 50 millisievert scales.
Ma'am, there is another question about the GGT, which is gamma glutamyl transferase, which is the
Okay.
liver.
Huh.
Uh,
Okay.
yeah.
Hmm. So again, the same thing. I think the question is getting repeated because, as I said, that post-COVID complications, the first line of treatment in homeopathy is the constitutional remedy, right? And whatever the state of whatever the remedy which is matching the to the state of the patient, the best fit to the patient. And I'm sure with the whatever the liver, any systemic damage, any problem, deal with the constitutional remedy. We need to take the case in detail for that.
Great, ma'am. Thank you so much for that lecture, understanding. And we have a lot of more lectures upcoming. And thank you so much, ma'am, for giving this knowledge and sharing your knowledge in your cases with us. Thank you so much to all the participants for joining. And we will meet tomorrow again at the same time. Thank you. The recordings will be available on Facebook. There's a live, so that will be on Facebook as well. Okay, everybody, take care. Thank you, ma'am.
Thank you, Dr. Harlin. Thank you.
Recording stopped.